Hi, I'm Dr. Craig Primack, a physician specializing in obesity medicine and SVP of Weight Loss at HIMSS. This is your guide to cardiovascular disease. Cardiovascular disease is a broad term that refers to many different kinds of heart or blood vessel disorders: valvular disease, arrhythmia, coronary artery disease, atherosclerosis, peripheral artery disease, aneurysms, deep venous thrombosis, and more. Unfortunately, cardiovascular disease is very common, with heart disease among the leading causes of death in the US. The symptoms of cardiovascular disease will vary according to the type. People with arrhythmias may experience a racing heartbeat, fluttering, shortness of breath, dizziness, or fainting. Coronary artery disease includes chest pain or angina, chest tightness or pressure, shortness of breath, and fatigue. Some symptoms are nonspecific, like radiating pain or nausea. Heart failure has some similar symptoms: shortness of breath, fatigue, and swelling in the ankles and feet. The most concerning symptoms to watch out for are chest pain, shortness of breath, and fainting. Different types of cardiovascular disease have different causes. Coronary artery disease is caused by a buildup of plaque in arteries that supply blood to the heart. This is called atherosclerosis. Peripheral artery disease is caused by a buildup of plaque in other arteries, and other types of heart disease can be caused by genetics or infections, connective tissue disorders, medications, and more. The risk of cardiovascular disease comes from lifestyle factors like high blood pressure, high cholesterol, smoking, lack of exercise, poor diet, excess weight, and excess alcohol use, and sometimes certain medical conditions like diabetes, chronic kidney disease, and autoimmune conditions. To diagnose cardiovascular disease, a healthcare provider will consider medical history and symptoms and may also conduct a series of tests: a physical exam to listen to the heart and lungs and check for fluid buildup called edema, blood tests and an EKG to see the electrical activity of the heart or other tests, and perhaps advanced imaging like x-rays, echocardiograms, or MRIs of other parts of the body besides the heart. The best way to take care of heart and blood vessel health is living a healthy lifestyle. But more specific treatments will depend on the type of cardiovascular disease someone is experiencing. Medications can help with things like blood pressure, cholesterol levels, blood clotting, heart rhythm, and fluid buildup. And for some types of cardiovascular disease, surgery or other procedures may also be necessary. Some types of cardiovascular disease are not preventable, like if someone is born with a heart condition. But for optimal heart and blood vessel health, it's important to make healthy lifestyle choices: eating a balanced diet, staying active, staying in a healthy weight range, getting proper sleep, maintaining good hygiene, and getting regular checkups. If you're concerned about your heart health, be sure to connect with your healthcare provider. And if you're curious about weight loss treatments, you can read more in depth and get a free consultation at hims.com.